Welcome students to our new YouTube channel Pharma Extech, the division of excellence. So in last video we start the new chapter which is anti-arrhythmic drugs. So let's continue to this chapter anti-arrhythmic drugs. So in that anti-arrhythmic drugs, the active ectopic beats, that means supraventricular R or ventricular active ectopic beats, and the general points in that the extrasystole and premature beats, one beat occurring before it would have been expected originating outside the AV node, and this is due to the irritation of the myocardium. Then next see the causes of this, and the causes include in excess sympathetic tone, ischemia, small calcified plaques, myocardial toxins, that means in alcohol, caffeine, nicotine and drugs, etc. Then next we see the paroxysmal tachycardia in supraventricular or ventricular, and the general points include in that the heart rate is above the 150 bpm, and this is due to the successive active ectopic beats or the presence of reentrant circuit. The reentrant circuits like flutter atrial, and the general points in flutter atrial is the heart rate is above the 250 bpm, and this flutter is due to the presence of one reentrant circuit, and the causes of this flutter is the presence of extranodal conducting pathways, that means whole Parkinson's, White syndrome, etc., and also increase in distance of conductance, that means in atrial ventricular dilation, and also decrease in velocity of conduction in ischemia, excess parasympathetic activity, etc., and also they decrease the refractory period in excess of sympathetic activity, etc. Then next we see the fibrillation, in that the atrial or ventricular fibrillation, and the general points of these fibrillations is the heart rate is above 350 bpm in fibrillation, and in flutter heart rate above 250 bpm, and in paroxysmal tachycardia the heart rate is above 150 bpm. So, and this fibrillation is due to the presence of multiple reentrant circuits. So next we see the relationship between the transmembrane action potential, ECG recording and cationic fluxes. In that the first one is resting membrane potential of myocardial cells is 90 millivolts, and the phase 0 is due to nil ion influx. Phase of action potential on which conduction velocity and of cardiac muscle depends is phase 0, and the phase 2 and phase 3 of action potentials are due to the K efflux, that means potassium efflux, and also the P wave and PR interval corresponds to the spike action potential of sinoatrial, that means SA node, and atria and AV node, and also the QRS complex corresponds to spike action potential of ventricles, and the ST segment corresponds to the phase 2 of action potential, and the T wave corresponds to phase 3 of action potential, and it corresponds to ventricular repolarization. Then next we see the classification of anti-arrhythmic drugs. So in that class 1 the sodium channel blockers IA also prolong action potential. So and the examples are quinidine, disopyramide, procainamide and muricizine. And next is first B, this also shortens the action potentials, and the examples are lignocaine, tocainide, mexiletine and phenytoin. And the first C class is there is no variable effects on action potential, and thus there is slow conduction in bundles of his Purkinje tissue, and the examples are flecainide, encamide and propafenone. So these flecainide, encamide and propafenone are the IC antiarrhythmic drugs. So next class is beta blockers, and the examples are propranolol, esmolol and sotalol. This sotalol is also in class 3, and in class 3 the drugs prolonging effective refractory period by prolonging the action potential, and the examples are sotalol and beryllium. This beryllium is also in class 2 activity. And the class 4 is calcium channel blockers, and the examples are diltiazem and verapamil. And also amidarone. This amidarone is in class first A, 2, 3 and 4. So next we see the drugs. In the drugs there is the antiarrhythmic drugs may be divided in 4 classes as per Wrangham-Williams system. The class 1 antiarrhythmic drugs. This class 1 antiarrhythmic drugs blocks the voltage gated sodium channels, that means in phase 0, and thus decrease excitability of the myocardium are use dependent, thus blocking the stronger side of the myocardium that more frequently depolarizes. And these drugs may be further subdivided in 3 groups. In that first A antiarrhythmic drugs, and there is cause intermediate voltage gated sodium channel blocks. So these class first A antiarrhythmic drugs causes an intermediate voltage gated sodium channel blocks, and also this blocks the potassium sodium leak channels in phase 1 and phase 3. Thus there is increased duration of repolarization in refractory period. So next we see the drugs one by one, so and their general points. So the first one is quinidine, and the general points about this quinidine is an alkaloid from cinchona bark, and dextroisomer of quinine is quinidine. So in GPAT the question is asked which is dextroisomer of quinine, and the right answer is quinidine. And also in pharmacognosy there is question that quinidine is an alkaloid from which plant or which source, and the right answer is cinchona bark. So this quinidine is administered orally, and also this quinidine also has a atropine like effects, and this quinidine is a representative antiarrhythmic drugs, and various drugs can serve as alternatives like quinidine. And this quinidine sulfate is also a complementary antiarrhythmic drugs for use when drugs in the core list cannot be made available. So this quinidine, when any other drugs in core list cannot be made available, so there is a one option remains, this is quinidine sulfate. So the tablets available for this quinidine sulfate is quinidine sulfate 200 mg. Next is the uses of this quinidine. The quinidine is used in the suppression of supraventricular arrhythmias and ventricular arrhythmias, and also in maintenance of sinus rhythm after cardioversion of atrial fibrillation. And this quinidine is contraindicated in complete heart block. So when there is a complete heart block, so this quinidine is not used. That means this is contraindicated in complete heart block. Next we see the precautions of quinidine, and it includes the partial heart block, extreme care in uncompensated heart failure, myocarditis, severe myocardial damage, myasthenia gravis, acute infections or fever. These fever symptoms may mask hypersensitivity action to quinidine, and also breastfeeding. Next we see the dosage. Initial test dose of 200 mg to detect the hypersensitivity to quinidine, and arrhythmias by mouth. Adults 200 to 400 mg dose, and 3 to 4 times daily. So this dose given by 3 to 4 times daily, and this dose increases if necessary in supraventricular tachycardia to 600 mg every 2 to 4 hours. and maximum 3 to 4 daily frequent ECG monitoring required. So these quinidine required the ECG monitoring, frequent ECG monitoring. So next we see the side effects of this quinidine, and it includes the ventricular paroxysmal tachycardia, that means Torsades D pointers, and these Torsades D pointers due to prolonged refractory period, and if any side effects of muscarinic antagonists, that means in atropine like effects, and also thrombocytopenia, that means autoantibodies against platelets. And next drug we see the disopyramide, and the general points about disopyramide is oral antiarrhythmic, and this is most potent anti-muscarinic. So this disopyramide is an oral antiarrhythmic and most potent anti-muscarinic, and this is same as quinidine. Then next drug is procainamide. So next we see the some general points about this procainamide, and this procainamide is an amide derivative of L-procaine, and this procainamide is administered by intravenous route, that means IV, and this procainamide hydrochloride is a representative antiarrhythmic drugs, and also the various drugs can serve as alternatives like procainamide. And the procainamide hydrochloride, this procainamide hydrochloride is also a complementary drug for use when drugs in the core list are known to be ineffective or inappropriate for a given patient. Then next we see the uses of this procainamide. This is used in severe ventricular arrhythmias, especially those resistant to lidocaine or those appearing after myocardial infarction, and also atrial tachycardia, and also atrial fibrillation, and also in maintenance of sinus rhythm after cardioversion of atrial fibrillation. Then next we see the contraindications of procainamide, and contraindications like asymptomatic ventricular premature contraction, Torsades D pointers, systemic lupus erythematosus, heart block and heart failure, and hypotension. So these are the contraindications of procainamide. They are hypotension, heart failure, asymptomatic ventricular premature contractions, Torsades D pointers, and systemic lupus erythematosus and heart block. So next we see the precautions of procainamide. This includes the in elderly renal and hepatic impairment, appendices 4 to 5, that means in appendices 4 and 5, and also the precautions in asthma, myasthenia gravis, pregnancy, breastfeeding, and this is used only under the specialist supervision. Next we see the dosage of this procainamide in ventricular arrhythmias taken by mouth adult up to 50 mg per kg daily in divided dosage every 3 to 6 hours, and this is preferably controlled by the monitoring plasma procainamide concentration by therapeutic contractions usually within the range of 3 to 10 micrograms per ml. And also the atrial arrhythmias higher doses may be required, and in ventricular arrhythmias by slow intravenous infusion the dose of adult is 100 mg at the rate is not exceeding 50 mg per minute with ECG monitoring, and this may be repeated at 5 minutes intervals until arrhythmia controlled the maximum 1 gram. Then next this ventricular arrhythmias by intravenous infusion the dose of adult is 500 to 600 mg over 25 to 30 minutes with ECG monitoring, and this reduces to maintenance dose of 2 to 6 mg per minute if further treatment by mouth required, and this allows the interval of 3 to 4 hours after infusion. So next we see the side effects of this procainamide, and side effects like ventricular paroxysmal tachycardia and systemic lupus erythematosus. So the side effects like ventricular paroxysmal tachycardia and systemic lupus erythematosus are the side effects of procainamide. So next we see the class first B antiarrhythmic drugs. This first B antiarrhythmic drugs causes weak voltage gated sodium ion channels. This causes weak voltage gated sodium channel blocks, and These class B antiarrhythmic drugs, they are selectively blocks the refractory voltage gated sodium channels. Then next we see the drugs of this class first B antiarrhythmic drugs. The first is lidocaine. Next we see the some general points about lidocaine. This lidocaine is general anesthetic and this is administered by intravenous route, and this lidocaine is performs the extensive first pass metabolism. So next we see the uses of this lidocaine, and the uses includes in ventricular arrhythmias and especially after myocardial infarction, and also this lidocaine is used in the local anesthesia treatment of arrhythmias associated with irreversible myocardial ischemia. This irreversible myocardial ischemia due to selective refractory blockage and also local anesthesia. Next we see the contraindications of lidocaine. Contraindications like in sinoatrial disorder, any grade of atrioventricular block or any other type of conduction disturbances, and also in severe myocardial depression and in acute porphyria or hypovolemia. These are the contraindications of lidocaine. So next we see the precautions of lidocaine. If the lower dosage in congestive heart failure, bradycardia, hepatic impairment, marked hypoxia, severe respiratory depression, following cardiac surgery, and in elderly and also in pregnancy and breastfeeding. These are the precautions of lidocaine. Next we see the dosage of lidocaine in ventricular arrhythmias by intravenous injection. Adult dosage loading dose of 50 to 100 mg or 1 to 1.5 mg per kg at a rate of 25 to 50 mg per minute, followed by immediately by intravenous infusion of 1 to 4 mg per minute with ECG monitoring of all patients. This reduce the infusion dose if required for longer than 24 hours. And note that the following intravenous injections, lidocaine has a shorter duration of action of 50 to 20 minutes. If it cannot be given by intravenous infusion immediately, the initial intravenous injection of 50 to 100 mg can be repeated if necessary once or twice at intervals of not less than 10 minutes. So next we see the side effects of lidocaine. The side effects of lidocaine are the dizziness, paresthesia, drowsiness, confusion, apnoea, respiratory depression, coma, seizures and convulsions, hypotensions, arrhythmias, heart blocks, cardiovascular collapse and bradycardia. This bradycardia may lead to cardiac arrests, and also nystagmus, often an early sign of lidocaine overdosage. So the side effects are most important for GPAT exams. Every side effects are most important. So in GPAT there is a question, which is an early sign of lidocaine overdose? And the right answer is nystagmus. So next we see the drug is phenytoin. So this phenytoin is anti-epileptic drugs, and this phenytoin is administered by orally, that means by oral route, and this phenytoin is same as lidocaine, that means the action of phenytoin is same as the lidocaine. Next we see the uses of this phenytoin. This phenytoin is anti-epileptic drug and it is used in the treatment of arrhythmias associated with the irreversible myocardial ischemia, and this irreversible myocardial ischemia is due to the selective refractory blockage, and this is used in the treatment of epilepsy. So next we see the side effects of phenytoin. It includes the vertigo, ataxia, nystagmus, headache, confusion and intellectual deterioration, gum hypertrophy, hirsutism. This hirsutism in that the abnormal growth of body hair due to increased androgen secretion, and also macrocytic and also hyperchromic anemia. This hyperchromic anemia is the disorder of folate metabolism, that means by folic acid forms the folate. This folate metabolism disorder is hyperchromic anemia. And also the side effects like skin rashes and teratogenesis. So next we see the class first C antiarrhythmic drugs. This class first C antiarrhythmic drugs causes the strong voltage gated sodium channel blockers, and the examples drugs like fluconamide. This fluconamide shows do not affect the action potential duration. Next we see the uses of fluconamide. Fluconamide is used in the treatment of arrhythmias associated with reentrant circuits, that means in strong general suppression. And the side effects of this Flecainamide includes the heart failure in patients with symptoms like in due to strong general suppression. So the ecanamide is also the same drug as that of flecainamide. That means flecainide. So next is class 2 antiarrhythmic drugs. These class 2 antiarrhythmic drugs, they are beta adrenergic receptor antagonists, and these class 2 antiarrhythmic drugs blocks the voltage gated sodium channels in phase 0 and calcium channels in phase 2. Thus, the decreased excitability and force of contraction of the myocardium, and also these class 2 antiarrhythmic drugs, they are used in the treatment of arrhythmias associated with the excess sympathetic tone. Then next we see the class 3 antiarrhythmic drugs. These class 3 antiarrhythmic drugs, they blocks the potassium sodium leak channels in phase 1 and phase 3, and thus there is increases the duration of repolarization in refractory period. And the drugs of this class 3 antiarrhythmic drugs like amiodarone, and let's see the some general points about amiodarone. This amiodarone is iodine containing compounds, and this amiodarone accumulates in tissues, and this amiodarone is administered orally, and this amiodarone it belongs to class 1A, 2nd, 3rd and 4th. So next we see the adverse effects of amiodarone. The adverse effects like hypothyroidism, hyperthyroidism, photodermatitis, corneal microdeposits. These corneal microdeposits do not causes the blindness, and also hepatocellular necrosis and also pulmonary fibrosis. These are the adverse effects of amiodarone. Next we see the drugs causing corneal opacities. The drugs causing corneal opacities are chloroquine, vitamin D, mepacrine and indomethacin. So the chloroquine, vitamin D, indomethacin and mepacrine are the drugs causing corneal opacities. So the drugs causing corneal edema are oral contraceptives. So these oral contraceptives are the drugs causing the corneal edema. Next we see the uses of this amiodarone. The amiodarone is used in the treatment of arrhythmias associated with the reentrant circuits in prolonged refractory period, and also in ventricular arrhythmias, and also in supraventricular arrhythmias in whole Parkinson's White syndrome. Then next we see the some side effects of this amiodarone, and it includes ventricular paroxysmal tachycardia, prolonged refractory period, and also hypo or hyperthyroidism in iodine. This is due to iodine and tissue accumulation, and also photosensitivity due to iodine and tissue accumulation, and skin discoloration. This is occur due to iodine and tissue accumulation, and also visual disturbances. This is due to accumulation in the cornea and due to iodine content and tissue accumulation. And also the side effects like neurological disturbances. These neurological disturbances are due to tissue accumulation. So these are the side effects of amiodarone. So the next drug is sotalol. Next see the some general points about sotalol. The sotalol is administered orally, and the sotalol is also a beta adrenergic receptor antagonist. Next see the uses of the sotalol is beta adrenergic receptor antagonist, and the uses includes the sotalol is used in the treatment of arrhythmias associated with reentrant circuits, and the sotalol is used in the treatment of arrhythmias associated with excess sympathetic activity. Then next we see the last is class 4 antiarrhythmic drugs. The class 4 antiarrhythmic drugs, these are calcium channel blockers, and they blocks the voltage gated calcium channels, thus they decreases the force of contraction. And these class 4 antiarrhythmic drugs, they are used in the treatment of supraventricular or atrial arrhythmias. So at last we see the classification of antiarrhythmic drugs. In that the first one is sodium channel blockers. In that first is moderate phase 0 depression, and the examples drugs like quinidine, procainamide and disopyramide and morphine. And in minimal phase 0 depression, and the drugs are lidocaine, mexiletine and phenytoin and tocainide. And in marked phase 0 depression, and the drugs like ecanide, flecainide and propafenone and endecainide. So the second is beta adrenoreceptor blockers, and the examples of beta adrenoreceptor blockers are propranolol, S-butalol and ismolol. Next one is, third one is potassium channel blockers. They are chromacalin and bencalin. So these chromacalin and bencalin are the major potassium channel blockers, and the last one is calcium channel blockers. They are verapamil and dilitazem. So verapamil and dilitazem are the calcium channel blockers of antiarrhythmic drugs. So in this way we end of this chapter of antiarrhythmic drugs, and hope you like this video. Please, if you like this video, please comment on comment section, and also please share this video to more and more to your GPAT aspirants as well as CET aspirants too. And please like, share and subscribe to our channel Pharma Extech, the division of excellence. So thanks for watching this video. Thank you for watching, and stay connected with Pharma Extech. Thank you for watching. Stay tuned. Welcome students to our new YouTube channel Pharma